international patient safety goal number 1, which is identify patient correctly. A very important thing for proper patient identification, that the patient actively involved in identification process. It's actively involved. That means you are not the one you are asking the patient, your name is Muhammad Ahmed, like this. No, the patient, you ask the patient, what is your name? And then you will counter check the tag identification band for the patient, and to make sure that this is correct. Number two, two permanent identifier need to be used when identifying any patient. And two permanent identifier mean something you cannot change. For example, patient name, it's a permanent identifier. And for example, file number or ID number or passport number. These are ID number, I mean, permanent identification that you cannot change. But some physician or practitioner using the room number. Room number is very dangerous because this is can be changed. And so it's better each hospital or institution to identify in the policy what are the two permanent identifier using in patient identification. I will show you example for a while. And then very important, as we said, to counter check the identification band. And if you have any invasive procedure, or you want to administer high risk medications, or you want to take the patient to R, make sure there is a double check with another verifier with you to ensure that this is a correct patient for the correct procedure. So in summary, when you want to check the patient identification, the answer is at every patient related activity. Every time, even if we know the patient, we need to remind ourselves about the patient and to ensure the proper process is going on for every time when you are administering medication, doing procedure, transfusing blood, endorsing between the colleague. It's not endorsement, say patient room number 101 has a 1, 2, 3, 4. The room number can be changed anytime. So this is a practice that we need to stop, and we need to correctly identify our patient. When there is also documentation or discharge or any procedure, you need to identify the patient. This is a practical examples for patient identification. For example, if you see inpatient and emergency department, here in our in Saudi Arabia, we have many patients having 4 similar names. So actually, we some hospital elected to have 4 patient name in the identification with the file number. From other nationalities may have no 4 names, so 2 to 3 names according to the availability of the names and with the file number. For example, unknown patient identification. Each hospital need to have a policy how to identify unknown patient. And this should be communicated with all and compliant with, because writing unknown. So if you have massive road traffic accident, you will find 4 or 5 patients with the same unknown. So it is very important to have a hospital-wide policy that support the identification of unknown patient. Lastly, but not the least, because this is a tricky part, which is the newborn identification. Newborn identification is a very big subject, but here in simple, every newborn has a 2 identification band. So the first band will be the mother ID band with the mother file number. The second band will be the child. So if the baby was baby girl, so baby girl off, and then the mother name, and the new file number will be given for each delivered baby. The same, for example, the tag, the pink for girl, blue for blue and boys, and white for like ambiguous genitalia or some certain situations. So this is in general, there will need to have a process in place to identify the patient correctly. And